I witnessed, recorded, and produced these videotapes of the Washington, D.C. hearing. Their authenticity is above question.
This is produced as part of the ongoing work on the website, thewaythetruthandthelife.net.
This is a hearing about the government licensing the electrocution of people to cause grand mal seizures. Think of the millions of dollars, taxpayers' money, spent to pay psychiatrists and their supporters and for the worldwide travel in putting this conference together, while the victims and opponents had to pay their own way.
They have a bad smell about them. These are called delusional depressants. It's among this most severe group, and especially the delusional depressants, that the data is the greatest and most intense, showing that there is efficacious use of ECT, that they can be helped by this. Mania is a condition which superficially resembles the opposite. People are going to be hopeless or to be happy. Actually, the manic patient is a person who's out of control, hyperactive, restless, can't sleep, thoughts racing, and unable to concentrate, feelings of grandiosity, able to do anything, will start many businesses, open numerous bank accounts, and are essentially inappropriate in terms of their attitudes about themselves. A subgroup of those patients, they're manic, are indeed characterized by symptoms of being so restless and that they can actually develop fever, and we are concerned that individuals with very intense mania out of control often do not respond to other medications and have to have ECT. And that's a fairly small group of manic, but still very impressive.
Is ECT separate?
One electroshock treatment can equal the energy of 3 pistol shots to the head.
Dr. Rose accepted 2 pieces of literature for reference. I would hope you might make copies available for the panel. We're talking about having a police factor information on a device and what we're using. And the one copy is the Thymatron, the brochure on a single sheet handout on the Thymatron pulse ECT device. And in there it shows the physical characteristics. I also included a current Winchester ammunition catalog because it shows the energy with which the bullets have. But running this machine at its maximum brings 201 joules of energy. That is 148 foot-pounds. If you're interested in actually understanding like the truth and lending and what they're talking about, 1 joule is 0.07376 foot-pounds. But what this means is this device, when operated at its maximum capacity, will lift a 1 pound weight 148.7 feet. The energy contained in that is equivalent to 3 25 caliber pistol slugs. Now that is just pure effective data. To give that lifting of 1 pound energy equivalence in informed consent, how could you not do that? And if you're going to give a procedure, the total energy and the total time are the physical parameters that characterize the device. How could you not include that information? And if a doctor prescribes a drug, he has to record the prescription. Why isn't the total time and the total energy recorded? This has been an experimental hazardous device for years now. Why hasn't this information been gathered that we could be talking with concrete objective facts rather than subjective opinions of psychiatrists and patients?
One electroshock treatment can equal the energy of 3 pistol shots to the head.
All right, out with your gun. Huh? Out with your gun.
Okay, this won't hurt. It'll be over in just a moment.
Uh-huh. What's that?
Conductant.
Oh, dab will do you. Right, Mr. Jackson.
Open your mouth.
What's that?
This will keep you from biting your tongue.
Well.
Now just bite down on it.
Oh.
That's right. Just bite down.
Huh?
Now bite down on it.
Good. Are you ready?
Ready. Mm-hmm.